A very good morning to you. My name is Jeff Stalford, Community Relations Director with Elville and Associates, and welcome to our webinar today, the 11th installment in the Elville webinar series, Wellness Series, titled Staying Mentally Sharp. So how this will work today, if you're new to our webinars, if you are, welcome. We're glad you're here. And if you're a frequent attendee coming back to see us, thank you as always for your support of our webinar series. So you as the attendee are currently in listen-only mode. However, we're going to continue to try something a bit different. As we want this to be as interactive as possible, we're going to unmute all attendees during the presentation when Ellen and Michelle are looking for your feedback and thoughts. So while you can still post your feedback in the questions panel at any time and chat feature, please feel free to speak up and let your voice be heard. You received the presentation by email from me yesterday to take notes on it if you wish. If for some reason you did not receive the presentation, it is currently located in the section marked Handouts on the right-hand portion of your screen to download at this time. Everyone will also receive a post-webinar feedback email right after the presentation. And we do ask that you please just take a couple minutes to fill out the simple survey to offer us your thoughts about the presentation. And we always read and value every comment that you share with us. Here at Elville and Associates, we work every day with families, with clients, with the ideals of client education, collaboration, and compassion in mind. We're always available for consultations to discuss your family's planning needs, and we look forward to being a resource to you anyway, now and in the future. So at this time, I'd like to welcome back and turn the webinar over to our presenters, Ms. Ellen Platt and Dr. Michelle Fritsch of Retirement Wellness Solutions, and Ms. Ellen Platt is with the Option Group, who will share a bit about themselves and get started with our presentation, which I know you're all looking forward to. So thank you, Michelle and Ellen, for being here today, and looking forward to hearing what you have to share today.
Thank you, Jeff.
Thank you, Jeff. We're glad to be here. And we imagine this is a popular topic because in today's society, it feels like there are a lot of things working against us to stay mentally sharp. So we're going to have some fun today, giving you a lot of tips that we hope you can apply immediately.
I'm Ellen Platt. I'm a geriatric care manager or aging life care manager and a founder of the Option Group. We provide case management and advocacy and help people navigate their medical care. And a lot of the folks that we work with have dementia. So what we're doing here is maybe being proactive one step before that, ways to stay mentally sharp and strategies and tools and tricks that you can use to kind of slow decline. But we are going to have a little bit of fun with this today.
Yeah, and I'm Michelle Fritsch. I left years of academia and traditional practice when I realized how much people could benefit from planning before they get to retirement, planning for their health and their purpose. And the things we're talking about today are an important part of that, of navigating that transition to retirement with a really healthy brain that can carry forward. So we're excited about this topic. Now,
go ahead. Last time we had done preparing for your medical visits. So we want to open the mic and open the chat right now to see if anybody took any of the ideas from last time, any of the nuggets, and prepared for a medical visit over the past month. If you do, or you had some good experiences or some bad experiences, please let us know and we can talk about it a little bit.
And again, everybody is unmuted at this time. If you'd like to share your thoughts that way, that's great. Or if you want to put it in the chat or questions panel, you can certainly do so.
Like having options. One of the things we talked about was taking 2 copies, one for yourself to take notes and one to give to the person that checks you in so that they can kind of get that into the doctor's hands. Did anyone try that, and what was your experience?
Another thing we talked about was taking your current medication list, and especially if you have multiple prescribers or different pharmacies, so that it can all be on one list.
So important. All right. Well, we'll keep going, but please, you know that we love for these to be interactive. So as you think of things, let us know, let Jeff know. We'd love to hear your thoughts. Another thing we've talked about recently in this series is your social health and your social network. So curious again, have you taken some proactive actions to expand your social network beyond your family and create new places where you can be engaged, meet people, do new things?
We have one person related back to the doctor's visits saying, I've taken a printed list of medications and surgeries.
Excellent. And can I ask,
And
was
then
that
we have,
Mhm.
and then we have one person saying, I started teaching a course.
Wow, excellent. Think about all the things that you know how to do that other people around you would probably really benefit from your help if they want to learn to do the same thing. I think that's a great idea.
We have somebody else that says, signed up for an online ASL class. Haven't started yet, but excited about it.
I would like to learn that too. And American Sign Language, I'm sure everybody knows that, but just to clarify. Well, good. Hopefully at the end of today, you might even find other ways to apply the things we've talked about the last 2 months to keeping your brain healthy, which we're talking about this month.
And one more, always carry full medical info in purse and give copies to doctors. Same with current questions.
Fantastic. Good. Ellen, you want to kick us off here?
Sure. We're gonna talk today about strategies to stay mentally sharp. And if you recall, all those things we were just talking about, the social wellness and taking care of your medical appointments, purpose, all those kinds of things all feed into staying mentally sharp. If you want to go to the next one, Michelle, all these different areas will feed into your health. So we've talked about the physical, preparing for the doctor's appointments, mental health, making sure that we're taking care of ourselves that way and reducing stress and anxiety, the social wellness, being able to stay connected with people and have a good support system. Same with the emotional, being able to connect with people or get to have experts in your corner should you need them. And then spiritual is also very important. And all of these different aspects of your life feed into your overall health and well-being.
And that includes your brain health. It's amazing how all of these things directly impact how your brain is functioning and how sharp is your thinking. So we're about to do something fun. I'm going to change the slide. Tell us what you see. Anybody willing to shout out what they see when they look at this picture?
Man blowing a horn, a man playing the saxophone,
A woman's profile.
a face,
Yep.
a woman's profile, a woman's face. Personally, I immediately saw two things. I saw the woman's face and the saxophone player kind of at the same time. Like,
Yep.
I don't know if that's unusual or not, but
And he is dancing.
He's dancing.
Oh.
Look it up.
If you see one, the face or the man with the horn, can you make your brain see the other? And while you're
We
looking,
have
I would
several
say
yeses.
good. I want to add a tip at this point, and that is you've heard us talk about purpose, and we're going to be talking more about that in future months. But knowing your purpose and that reason for being, almost back to the person that's teaching the class, that keeps your brain engaged, involved, and thinking about new things. So that is another step toward staying mentally sharp.
So some of the physical strategies to staying mentally sharp are, we hear about these a lot, and it's important for all aspects of your life, but staying mentally sharp is diet, especially being mindful of sugar, alcohol, caffeine intake, but also eating a nutritional diet, having exercise, making sure that we're moving, we're getting those endorphins going. And then the reverse of that is making sure that we get enough sleep at night. So active during the day, get our bodies moving, but making sure that we have time at night to be able to fully rest.
And if you're interested, we've got lots of sleep tips and other items to share, same with diet and exercise. So anytime that we mention something like this and you're like, well, how do I improve that? Please let us know. We would love to talk to you about that. New picture. Do you see movement?
Yes, in the center.
And if you do see movement, can you stop it?
If I look to the outer edge, I can look away from it.
Isn't that wild? Because Ellen, is anything actually moving?
No, nothing's moving. It's your brain playing tricks on you.
I find I really have to focus to stop the movement. And even then, it's hard to hold it there.
Yes.
Anyone else? Mm-hmm.
We have many that agree. The more you focus, the more it will stop, but it is hard to get it to stop.
I notice if I get one part of it to stop, another part will move.
Yes.
Mhm.
I also want to add a tip about the movement that we just talked about. Sometimes when we hurt, we've got sciatica, back pain, neck pain, hip pain. Our brain tells us that we should just hold still and that will help reduce the pain. But really the opposite is true. The more we move and stretch and get those parts moving, sometimes we really need the help of a physical therapist to make sure we're doing it the right way. But movement actually relieves pain and helps you sleep better with less pain, rather than, again, what our brain tries to trick us into, which is just sit still and the pain will be less. All right, let's move on. So when we think about strategies to stay mentally sharp, one piece of it is our mental health. And so knowing ways to identify when we might be experiencing depression and then taking steps to address that. Depression is sometimes very temporary. It's related to a situation, or we're sick, we're just not feeling good, we kind of get into a depressed place. So sometimes it's what we might call self-limiting, or it resolves itself with actions that we can take. And sometimes depression is much bigger than that, and we need counseling and maybe medications to help resolve it. Same with anxiety. We can be momentarily anxious about something and it's able to resolve through some of the strategies we can employ to help ourselves calm that. Sometimes it's bigger and we need counselors and we need medications to really get a handle on it. And then focus, we just practiced focus with that picture, trying to make it stop moving. But all of these things need to be addressed if they're issues in order to keep your brain healthy and fully functional.
And I was going to say, a good physician will actually screen these out or rule these out before going to a diagnosis of some type of cognitive issue, because depression, anxiety, difficulty with focus, that can really mask itself and look like early stages of dementia, but it's actually not. So it should be ruled out first.
Great point. Great point. And any medications that are impacting your ability to be fully awake and sharp, that needs to be addressed and those need to be removed before you ever get to that diagnosis. Great point. Speaking of that, in our brain, if you look at the little brown circle that's sort of at the bottom of this brain picture, the amygdala, that is the part of our brain that reacts to things that scare us. It's kind of the fight or flight center of our brain. If we're being chased by a bear, we want that to be the part of the brain making decisions, because it's all about protecting us and getting us out of harm's way. However, when we're not being chased by a bear, it's that much larger front part of the brain. That big part at the front of our brain is the one that is able to think calmly and rationally, to make a detailed plan, to be creative, to think of new ideas. I've had so many people tell me in the last couple of years in particular that I used to be creative and there's not a creative bone in my body any longer. It's still there, but you're not quieting your brain to get back to letting that part of the brain be the part that's really in the driver's seat, that's making decisions in your life. So one piece of staying mentally sharp is recognizing when you're in that anxious, chased by a bear kind of mode with your brain, which does not think deeply and does not really figure out plans. And then learning to resolve some of that stress and let this other part of your brain take back over. Ellen, what would you add to that?
The part of the brain that Michelle was talking about in the front, where you're doing the creative work and you're calm and you're thinking, that part of the brain, the frontal cortex, is also really involved with decision making, organization, planning, problem solving, those higher level functions. So if you can work from the top of the brain instead of that, what I call the lizard brain, where you're reverting to that fight or flight mode, that is where you're able to do your best work.
Are there questions or comments about that? Because it's really critical to brain health and to just day-to-day, moment-to-moment, making good, clear, sharp decisions.
We have a couple of comments saying it is very difficult to quiet my brain. We have a comment from somebody saying this morning, the U.S. Preventive Services Task Force said that adults under the age of 65 should be screened for anxiety. Recommendation posted today.
Wow. Especially in today's environment, that does make sense. I'm taking a note. I'm going to go look that up.
Yeah, and thank you for all the comments today. Very helpful and interesting.
Yeah. So we have another challenge for you. How many legs are on this elephant and where are they? Anybody else struggling to count?
It depends on how you look at it, but 5 or more.
Well,
Personally,
you're
I would say
struggling.
5. We have a number of people saying 5.
That's a typical elephant.
I think repeating the question, we had a couple people asking if you could tell us the number of legs on the elephant.
While you're looking at the elephant legs, I want to bring up another point, which is that when there's heart disease, sometimes one of the factors of your sharp thinking is making sure there's good blood flow to your brain. And so when there's heart disease, sometimes the output of blood from the heart or the efficiency of the arteries through which the blood is flowing can be impaired. So when you are experiencing mental fogginess, you feel like you're not thinking in a really sharp way, one thing for your medical team to look at is how healthy is your heart and how much blood is flowing to your brain in the proper amount. So they might scan your carotid arteries, and certainly there are a number of tests to determine how efficient is your heart function. So one other little component of staying overall mentally sharp.
So what are social strategies that you guys use to stay mentally sharp? What are ways that you engage with people? Sometimes we engage through our faith community, sometimes through our children, maybe it's through work. There's lots of different ways to engage, but a lot of people as they age start losing their friends. They may move away, they may pass, they may get sick and just not be able to get out longer. So it's really important as we age to make a point to engage with people, to keep our friends. And when we're learning new things and trying new things, taking a course is a great way to do it. Somebody mentioned earlier that they're actually teaching a course. So that's the best way to become an expert on something, is to be able to actually teach it. But that is a way that you can create new connections with people that have like interests, and makes it a little more interesting and fun.
And not necessarily the same people all the time, but finding opportunities to meet new people, have new conversations.
We have a number of people who I know are professionals saying lots of networking, attending lots of webinars. The best is engaging with people. New things are also very helpful.
Absolutely.
And volunteering with something.
Yes,
Meeting
that's a
people.
great one.
Volunteering
Yes.
is great.
Very good.
Right.
We have another challenge for you. What animal do you see?
For animals.
Both a rabbit and a bird?
Yeah.
Very good. Switching back and forth. Isn't it amazing how one image can make you see two things? So I have one more tip with this one. Ellen mentioned diet earlier when we were thinking about the physical health aspect of keeping your brain healthy. An element of that is to reduce the amount of fat intake, because as we eat fat, that can accumulate in our arteries, which is where the blood is flowing through from place to place. And when those get clogged up, if you will, with the fat, that can be one of the things that impedes the blood flow getting not only to your whole body, but getting to your brain to allow you to think clearly. So one tangible step you can take is to think about how much fat you consume and what you can do to reduce that. Now we're going to switch to emotional strategies. So emotional health part is, I talked to somebody this morning who's like, I'm just going so fast. I can't even keep up with myself anymore. I can't focus when someone is talking to me. I can't seem to rest. It's my brain is going all the time. I'm going all the time. Whew, how do you calm that down? How do you intentionally take some breaks to quiet that? How can you manage stress? Recognize when you're up over the top, can't focus anymore. How can you calm that down? What are the things that set you off, that get you into that anxious or fight or flight mode? If you know that you're going to be encountering some of those, how can you prepare yourself to not have such a big reaction? So that's a lot to think about. I'd love to hear, what do you do when you recognize, oh my goodness, I'm just like in that nonstop mode? How do you calm yourself back down? And what role might a support network play? I would just love either whether you want to speak to us directly or share in the chat, what strategies do you have to calm it all back down?
We have somebody that says they change their setting or change their task,
Good.
walk around, go outdoors if feasible.
The deep breathing exercise, which you have mentioned before.
Doesn't that help?
Mhm.
Physical
And you have on there,
exercise.
go
I'm
ahead, Jeff.
sorry. Physical
ahead.
exercise and music.
Yeah.
On there is taking breaks. One great thing to do is to block out time. You know, we think we're going to get around to that break, but we may not. So actually blocking out time, even if it's 10 minutes or 15 minutes, to get up and take that walk or have some mindfulness time or do some deep breathing. It's actually scheduling that time, because most people think they do it or they're going to get around to it. But if you actually log it or journal it for a couple of weeks, you'd be surprised how few breaks you actually take. That's really focused and mindful. So I challenge you all to track your breaks over the next, say, 2 weeks and see what you come up with.
That's good. Now, this one's going to be TMI, too much information. But if you have a Fitbit or an Apple Watch, not to get into brands, but something that tracks your activity, I find that motivating because it gives me credit when I do something. And one of my favorites, if I've got 5 minutes, is I do crazy dancing. And so it gets your body moving in a lot of different directions. You can put on some real pump up music and really go crazy, because if you're having to stay in that professional focused mode all the time, sometimes to let loose is very helpful. And if that's just me, forgive me that I'm that weird, but does anyone else try that? You just really get crazy for a little bit? Nobody?
Ellen, it's just you. I wish I could do that though.
You might have to do it in a place where no one can see.
I
This
definitely would.
This next one's one of my favorite brain challenges because I cannot do it.
So
What
this
color?
is a dress. What color is the dress? Some people look at it and they see a black and blue dress. So a blue dress with black trim. Some people look at it and see a white dress with gold trim. Which one
I
do
can
you see, and can you flip it the other way?
only see the white dress with gold trim, and I cannot flip it. I have tried and tried, and I haven't yet figured out how to change it in my brain.
Is there anybody on that's able to see both?
We have white and gold, blue and dark gray, blue and black, white and golds, blue and black,
Blue and brown.
Blue and brown.
blue and brown.
blue and gray.
Blue and gray.
Let me ask you something, Ellen.
Yeah.
How can this seems like it'd be something that's just kind of a black and white situation where there's a right and wrong answer. Is there something that's your brain plays tricks on you, or is it the way that we see colors?
It's the neural pathways that are playing tricks.
Okay.
As you saw just in this group, we had 5 different combinations of colors. It's just how we interpret.
How many of you are able to see more than one? Like you see it as dark colors and then you can flip your brain and see it as light colors.
Yes, there are almost 6 different colors.
Wow.
Interesting. Interesting.
Isn't that fascinating?
It is. It is.
Any other comments on this one?
Several people saying that they can only see one color and they just can't flip it.
Yeah.
Including myself, I can't flip it. Although I can see some blue in there, sneaking in there, but I can't just flip it and see several colors.
Yeah, this one frustrates me. I want to see those other colors.
I want to be part of the group too. Yeah.
Exactly. I got FOMO.
All right, Michelle, you want to talk about spiritual strategies?
So spiritual health or spirit, however you express your spirituality, it is a part of who we are. And so if that's not something that you typically give very much attention to, we encourage you to explore. What does spirituality mean to you? How does it impact you? How do you express it? And if it's not something you explore very often, we encourage you to kind of give yourself some time to think about it, to think about your mindset. How do you make big decisions? What do you feel any sort of guiding force in your life? What drives your decision-making process? What brings you hope or calms you when you're feeling stressful? And it's amazing how everyone I talk to has a different version of this, whether they take a religious approach or not. So this one is so variable, and some people get a little guarded when they think about a topic like this. So I would love for there to be some conversation around, do you think of yourself in the spiritual realm, and is that a big part of your life, a little part of your life, maybe something you've not yet explored? I'd love your thoughts.
And you're right, Michelle, a lot of it is, again, just blocking out that time and spending time with yourself to see what's important, trying different things. Some people like to journal and kind of track their thoughts and then go back and review it over time. And you might start seeing patterns or start having a deeper insight.
I feel like I need to mention this. I know some people use substances to explore different thoughts and feelings. As a healthcare provider, I have to not encourage that. But there's alcohol, there are opiates, there's marijuana, there's ecstasy. There's so many substances out there. I encourage you to at least be careful if you're using those, to let your healthcare team know if and how you're using substances, because substances can, in some cases, maybe help you think different thoughts, but they can also impede good, sharp thinking, especially when they're misused.
So we do have a few comments. One Several. One says, I've not taken the time to explore continuously busy. Spiritual depends on events. Yes, when dealing with relatives' death or serious illness. Started Zooming to religious services and now look forward to it. Feel a sense of community. Journaling empties upsets. Okay, so journaling empties upsets and problems. Write for oneself. No rules, grammar.
Yep.
No rules or grammar, I think that's supposed to say. So yeah.
Yeah, just let it flow. Don't worry if you spelled it
Yeah.
right or if you punctuated right. I like that.
Yeah.
And this not crosses, this gets into kind of what we talked about with emotional health as well. The calming techniques, the breathing can help you explore that calming your brain as well as the spiritual aspects. So as you're pondering that, what do you see in this picture?
A lion and an ape, and then a tree, of course, in the background.
Mhm.
To
Good.
call it the tree of life.
Could be. Yep.
Tree, gorilla, and lion from a few people.
Uh-huh.
I see fish jumping out of water as well.
Yeah. At the bottom.
Yeah, I hadn't
Circle
seen
of
that
life.
before.
Tree, ape, and a tigerfish.
Interesting. So much in one picture. Ellen, what's your recommendation here?
So change it up. It's great to try novel things. That's really one of the important things of brain health and brain strategies and maintaining our cognition. So a lot of people say, I'm good. I do my crossword puzzle every day. And that's a great way to kind of exercise the brain. But there are many different areas of the brain and activities use different areas of the brain. So a crossword puzzle may be good for one part of the brain, but it's not exercising another part of the brain. So think of your brain as a quote unquote muscle that you need to exercise, and you're going to do different activities to exercise different parts of the brain. You may want to use sensory, music, smells, essential oils. You may want to do a crossword puzzle one day and Sudoku another day. You may want to do word search. You may want to do puzzles, interactive activities, socializing. There's lots of different ways that you can exercise different parts of the brain. Learn a new language. But the more that you do, the wider you cast the activities, the more areas of the brain you're going to help to maintain. So if you take any little nugget away from this, is try something new. Be brave, put yourself out there and try something new.
So how challenging is that? Is that something that you feel like you're already doing? Or does that challenge you to rethink some of your processes and ways that you can further engage your brain?
And if somebody is trying something new, share with us what that is.
I have one person saying that's an excellent suggestion. This is a challenge in retirement.
It can be. And we're finding that it's critical to a really successful retirement versus one that sort of leads to the decline. Well, speaking of challenge, I have a challenge for you. This is one of my absolute favorite photos of members of my family. We were on the south edge of the Grand Canyon, right on the edge of the canyon, and my children were doing the junior naturalist, the activity book that's given to kids to help them to fully engage with the national parks. And they're sitting again on the edge of the Grand Canyon, and they were challenged to use all of their senses and then to journal what they found. So they're, what do they hear? What do they see? What do they smell? What do they taste? What do they feel? It was an awesome exercise. So I encourage you now, we're going to take 60 full seconds and do the same analysis. Use all of your senses right now where you're located. So what was that experience like? And did you find with time that you sensed more things?
As somebody said, I did have a greater sense of what was actually going on around me. Somebody say yes, definitely. Somebody saying seeing the monitor, hearing your voices, feeling my butt on the chair, touching the keyboard, tasting my coffee. Deliberate attention yielded more awareness. Very interesting.
For me, one of the most calming things I can do is to go out into a forest along a stream and do this exercise. Just to be outside, and something about moving water just really, really calms me. So this is something you could do in the boardroom. You know, things are getting a little crazy. You need to resume your focus. Just do a sensory awareness. Nobody even has to know you're doing it, to kind of refocus your brain, but also to help calm yourself. Find a place that you like to be and do this exercise and see how, if that helps you move into that front part of your brain.
One person that says it seems easier to sense things one at a time. For example, closing your eyes, plugging your ears, etc. One person says, I have a bubbling fountain in the small fish pond in my back patio, very restful.
Yes.
And I agree, the walk along a stream in the forest, that's to this day still, even though my kids are growing, one of my favorite things to do with them. Just the sensory experience. Been doing it with them since they were 5 and 3 years old, and even younger than that maybe, and just the feeling is one of the best in the world.
Love that.
Sometimes that's why it's hard to calm the mind, because so many things are coming at all your different sensory receptors, and it's hard to calm the mind when you're getting it from all different sides. So sometimes going into a quiet room or going by a brook where you can focus on one thing at a time helps you quiet your brain.
Absolutely. Now we're going to look at something that is not so great for your brain health. Pre-pandemic, Statista, a statistics gathering group, found that people over 65 on average, so you know there's some people below it, but there are people above it, on average, people over 65 spent over 7 hours a day, 7 days a week watching television. That does not allow you to move. It does not usually lead to good dietary habits. It does not allow that diversity in your brain. Watching different TV shows doesn't count as mixing it up with different stimulus. But boy, is it not easy to get sucked into this. Does anyone struggle with this or have tips to reduce the amount of TV consumption? Maybe that one is a known factor. Even if we do it, we kind of know that it's not the best way to spend many hours.
We have a couple people saying it takes true discipline to reduce it.
It does.
One person saying guilty as charged.
Understand. Try one more brain teaser. Actually, I guess we have a couple more brain teasers. What do you see here?
A plant and two faces. Several comments stating that. A man and a woman.
Good.
Two people facing each other. Many of the same comments, yes.
Good. Well, I'm going to start this one off, but then Ellen, I'd love your perspective. Medications can really hamper sharp thinking. I would say as a clinician, one of the most important things I do that leads to people feeling better is work with their healthcare team to remove medications that have really hampered their ability to think well. Ellen, what would you add to that? Because I know that with what you do, that you see it all the time.
A lot of the folks that I work with are older. And one of the things that I see quite a bit is that they've been on medication for many, many years. Maybe they've slowly increased it. But as you age, you metabolize medications differently.
Yeah.
And it's really important that the physician, primary care physician, knows all of the medications so we can see if there's polypharmacy, but also review it to see if that still is the appropriate dose, because you don't always want to go up with the dosage.
Especially as we're aging. You're absolutely right. I want to add a sciencey piece. Over the last, almost 20 years now, we've learned more and more about genetically who we are as people and how different we all are genetically. And one factor is this thing called MTHFR. So if you've had a genetic test, if you're thinking about a genetic test, that is just one little genetic element to check on. But there are a number of people who have some changes genetically, in their MTHFR, and it just means that they're not able to break down their folate, one of their B vitamins, properly from food. So they can eat folate, folic acid enriched foods, but it's not going to help them. And if they can't get folate in a format that their body can use because of the genetic difference, that leads to anxiety, depression, and difficulty sleeping. So if you struggle with those things, I highly encourage you talk to your doctors about a genetic test to check MTHFR. If you want to know more about that, I mean, it's hard to cover it here in just a few seconds, but whew, I've seen it make some big differences for people, and it's an easy, inexpensive way to help manage some of those mental, emotional health things and to get a lot more sleep. So in Propel, in the product that Ellen and I put together, there's so much more detail on all of these topics, but I had to at least throw that one in there to some degree at this point.
Good question.
Yes.
Are there common medications that cause issues with sharpness and recommended vitamins you may suggest?
Vitamins won't change the impact of the medicines and what they do with sharpness. In our brain, there are so many neurotransmitters that help guide our thought processes. And so there are a number of medications that change the amount that's produced in our brain, the way that it's used within our brain, the ability to transport it from one neuron to another. There's so many complexities that one of the big places to start is just to see if there are medicines that are causing whatever foggy thinking symptoms you're having, and working with the team to solve whatever problem, whatever reason you were taking that medicine, find another option that doesn't have that side effect. It's one of the things I love to do. So if I can help you, let me know. But then vitamins can play a role, but just not kind of one solution fits all. We'd have to do just a little bit of digging to figure out if what you're thinking and feeling and experiencing is related to vitamins, then what vitamin supplements would make sense to overcome that. Like even back to the MTHFR, taking more folic acid won't help if your issue is because genetically you can't use folic acid. Then we'd have to move to the already metabolized folate so that your body could use it properly. Again, it's a big topic and it's hard to cover it in a few seconds, but I at least want to make you aware of it so you can start having those conversations with your healthcare team. As always, time is getting short, so I'm going to keep us moving, but isn't this a brain teaser of a picture? Based on the things that we've talked about, have you ever done like a popcorn exercise where everybody just kind of says what's on their mind? We'd love to do one of those for a little bit. What have you taken from today that you can implement right away and go, oh my goodness, I could do this or that to help keep my brain healthy and sharp?
Join a club.
Good.
Move more.
Yes.
Comment from the audience.
What else?
Variety is the spice of life.
Yeah.
Says our good friend Joe Sperling of Joe Sperling Insurance. Wait a minute, I lost it. Where'd it go? Less TV, more movement, more social activities, read more. They're coming in fast and furious.
Love that.
Walk. Need to plan better each day to incorporate exercise and less TV.
Good. I hope this continues as you go through your day of, oh my goodness, I could do more of this, more of that. I should check out that. I'm going to research that. I'm going to think about meeting these people.
Get a puppy, rescue one. Recoup from COVID brain fog. I'm sorry to
Yeah.
hear that. Yes, please feel better.
They're all so good. And share all of this with your friends, your neighbors, because I think as a society, this trying to figure out how to reclaim our brain, if you will, and keep it healthy is something everybody's thinking about.
Well, I like this one. Put up a bird feeder. Yes,
Yeah.
that is so helpful. I have 8 bird feeders in my backyard. I'm just tattling on myself, but it's so restful and peaceful.
Yeah.
It's one of my enjoyments.
Then you can research all those kinds of birds.
That's right. Yes.
Before we wrap up, Ellen, what tips do you have for us to, how did we calm down that brain?
Yep. So what we're going to do is just a really quick few-minute activity and just to get you started, but then it's something that you can practice when you have some alone time or quiet time. So if you just kind of sit comfortably in the chair, your feet on the floor, feet apart, don't cross your legs, and go ahead and just close your eyes and do a body scan. Think about all your muscles starting up at your neck and your shoulders, and just work your way down your body. You can move a little bit if you need to get yourself comfortable. Stretch out a muscle and just start taking some deep breaths. Breathe in for 5 and hold it. And breathe out for 5. And just continue that pattern. Breathe in for 5, hold it, and breathe out for 5. And as you continue to breathe, just make your way down your body and take note of any areas that might have some stress or feel a little bit tight. And if you notice a spot in particular, breathe into that area and then visualize when you breathe out, all that stress is just going to release with your breath. Continue your body scan until you get down to your feet. And continue breathing. And work your way back up. And again, if you notice an area that's particularly tight, breathe into that area and just watch it release with your breath. Make your way back up to your shoulders and your neck, which is where a lot of people hold that stress. Gently tip your head to one side. Gently tip your head to the other side. And continue that breathing. Put your chin to your chest if you can. Have a little stretch, gentle stretch in the back. And gently look up at the ceiling. And stretch your neck. Take a couple more deep breaths. And then we'll come back to the group. So that's something we just did maybe 60 seconds. But if you took 5 minutes and did that scan a couple of times, I think you'll be amazed at the difference that you experience afterwards. A good way to gauge it is rate yourself from 1 to 10 to the level of stress you have when you start, and then rate yourself when you're done and see if that number has changed.
Now I feel a lot better. Thank you, Ellen.
Okay.
This time always flies by. We hope you've gotten a lot out of this. Again, things that you can apply right away. We want to hear next month that your thinking is sharper, that you've had a chance to do these things. And I just want to wrap up that Ellen and I have been in this space for a lot of time, and we have found just way too many people slide into retirement without a plan, and 2 out of 3 fail. Either rapid health decline, relationships fall apart, or they lose their sense of self, and that leads to a spiral of depression. We don't want that for anybody. So we've created a process that's proactive before even getting to retirement or early in retirement. We've got a process to help you in each of these areas. So the things that we do each month with Elville are just kind of the tip of the iceberg of all of the information that we've got to share with people. We invite you to join us. We sent some tips that have even more things than we could squeeze into today for you. And by claiming those, you'll also get on our list so we can just keep feeding you information that we want people to know to prevent those negative outcomes of retirement. So please join us. If you'd like to check out Propel, we've got a very special deal here. Once you go in, if you use the code Elville, you can either get the monthly fee down to $10, or we'll give you a whole year of material for $120, just $10 a month. We'd love for you to experience it. Help us get the word out so that more and more people have that time of retirement that's healthy and active and engaged, and they don't fall into these pitfalls. So we thank you for taking time with us. Next month, we're going to talk about the difference between fulfillment and just staying busy. Because we see so many people that they wake up in the morning and say, how am I going to stay busy? It can be so much more than that. So we look forward to continuing the discussion with you, and thank you for spending time with us.
Well, thank you, Ellen and Michelle. Boy, this is always one of my favorite hours of my entire month in working here at the firm, and I've got a lot of great time working here at the firm. But this hour of our wellness series is certainly up there, and today was just a great experience, and I hope that our attendees out there felt the same way. Thank you for being such an integral part of the presentation today for everybody out there. Thanks for your comments and your thoughts. Really makes a huge difference and just adds a lot of value and helps everybody else too, listen and learn as well. So just a quick side note, our wellness series has grown so much in just the last 11 months or so. We had over 80 people sign up for our wellness series today, which is just so great to see. And we would just want to keep it growing. So let everybody know about the wellness series that we have here and what we have going on this next month and what you just experienced. And we want to keep it growing and let even more people know about it for the coming months. So thanks to Michelle and thanks to Ellen. And check out our events page on our calendar on our website. We have so many interesting webinars coming up as part of our webinar series. It's jam-packed with a lot of interesting legal and non-legal topics, and look forward to seeing you on some of those as well. So thanks for being part of today. Look forward to seeing you again soon, and have a wonderful day. Thanks.